Good evening. Welcome to Behind the Robot, why proper processing of robotic instruments matter. I'm Lanisha Wells, and today we'll be discussing robotic surgical instruments, the challenges associated with processing these complex instruments, and why proper cleaning and sterilization are critical for patient safety. As sterile technician and surgical tech continues to evolve, robotic assisted surgeries have become more common in the States and across the country. Robotic systems such as Vinci surgical systems allow surgeons to perform procedures with greater precision, improved visualization, and smaller incisions for patients. While these advancements have improved surgical outcomes, they've also created challenges for the sterile processing department. My main argument today is that robotic surgical instruments require special handling, cleaning, inspection, and sterilization procedures. And failure to properly proceed with these instruments can cause patients risk for infection, surgical delays, and equipment damages. Throughout the podcast, I'll also discuss unique designs of robotic instruments, common challenges, evidence-based solutions that facilities can implement to ensure patient safety and instrument longevity. Before discussing the challenges, it's important to understand that making robotic instruments are different from traditional surgical instruments. Robotic instruments contain multiple parts, insulated components, cables, and delicate mechanical instructions. Unlike standard surgical instruments, they can often be visually inspected with the naked eye. Robotic instruments frequently require magnification and specialized testing equipment. Instruments used in robotic surgeries may include robotic gaspers, needle drivers, monopolar scissors, bipolar forceps, camera systems, and endoscopes. Many robotic instruments also have a limited number of uses before they must be replaced. Because instruments are expensive, some costing up to hundreds of thousands of dollars per instrument, proper handling becomes extremely important. One of the biggest challenges facing sterile processing professionals is effectively cleaning the robotic instruments. The complexity of the robotic devices creates a number of areas where blood, tissue, and bioburns are trapped within the instruments. Insulated layers, moving joints can be difficult when accessing during cleaning. If debris remains inside these instruments, sterilization may not be effective as it should be. Robotic instruments are highly delicate. Improper handling of these instruments with transportation, as far as cleaning and assembly can result in bent shafts, damaged insulation, malfunctioning jaws, broken components. Even minor damages may cause instruments to fail during surgery or cause surgery delays, also assisting increase in costs for the healthcare facility. Sterile processing techs must often use magnification devices and insulation testers to identify defects that may not be visible to the naked eye. Without proper inspection, damaged instruments could be returned to service and potentially compromise patient safety. There are several solutions that can reduce these risks, however. Healthcare facilities should provide ongoing education training and sterile processing personnel. Robotic technology continues to evolve. Technology must be current, manufacturer recommendations, and industry standards. Departments should also follow manufacturer instructions for commonly known as IFUs. These instruments provide specific guidance, cleaning and inspection, assembly, and sterilization rules. Lastly, communication between the OR and sterile processing department is essential. When damaged instruments are identified, reporting procedures should be followed immediately and corrective action should be taken. To conclude the robotic surgical instruments, conclude surgical instruments have been transformed modern surgery by improving precision and patient outcomes. However, these benefits come with increased responsibilities for sterile processing professionals. As a future healthcare professional, it is important for us to recognize that even in the most advanced technology depends on instruments and the care behind the scenes. And that concludes our podcast.